day Sarah Myrie, who just went PRN. She wants to go like this, but she's working on Saturdays sometimes for us. And now we have Lori, well, or Bicey, Lori Bicey, what they are. She wants to come and be in New York full time, so we're kind of transitioning right now. I think January 2nd, she's there.
So Sarah, oh, I bet you were
I know.
sad.
I went through depression.
She's like,
So good. She is so good. And
yes.
kind of like when you work with someone and you told them what you know, and then they know it, and then they do it. It's just so effortless.
Yeah.
You know, she was so good.
She just knew.
She just did it. And she was, she just had great skills. But Lori's gonna be great too. Lori is great, but she's done more nursing home here, I would say mostly in her career. So yeah, but she's just like a sponge. She just asks stuff all the time.
That's good.
Seriously, she's
Cool.
great.
Okay, so I'm gonna be your little secretary and I will run it.
Perfect.
Yep.
Okay, so we'll just start, you guys, so you don't have to be here all night. I'm Lisa Hennen, like we said. I've done physical therapy, I think 28 years now. So
She started when she was 4.
I started when I was 4. Yeah, I look so young. No, but I started out wanting more education in like neuro. So I got trained at the Rapid City Regional Hospital. They sent me off to do neuro developmental training. So I worked a lot at the rehab hospital with like strokes and spinal cord injuries and that kind of stuff. And then we moved to Britain, South Dakota, worked in an outpatient clinic, and then worked in the school system doing pediatrics. And then we moved back to Rapid City, worked in a hospital setting, weekends and once in a while during the week, because we had 5 kids by then. And then moved back to Minnesota and then did outpatient again in nursing home. So kind of done a little bit of everything, but worked for Big Stone 15 years now and dry needling since like 2017. So Big Stone was good enough to bring in a course based out of, I think it was Atlanta, Georgia, was the MyoPain site where they brought in 3 courses to Marshall. And so I got trained and certified in through them for deep dry needling. So if you hear about dry needling, there's like 6 different kinds, I think now. A lot of different companies teach it a little different just to kind of, I think, make it their own. Because everybody wants to have their own little twist on it, seems like, their little spin. But MyoPain is one of the older companies in the whole US. So I really like what I learned. I think it's super effective. It's it really helps a lot of people with a lot of different conditions, whether it's chronic pain, acute pain, limited range of motion, even neurological patients. I've used it on like stroke people, so the decreased tone. So yeah, it's just really good. It's just a really good technique. So if you guys end up going on for more schooling, like with Chris, with her, I'm guessing a lot of you, are you pre-PT? Or pre something? Not quite sure yet. You're pre-PT? Athletic chiropractor. Gotcha. Well, and there are chiropractors that are getting certified in it. I know even in Minnesota, there's 1 or 2 at the Fixing Clinic that just got certified, although I don't think it's the same kind of deep dry needling that I got certified in. That's why I say it's a little spin. Everybody's got a little bit different spin to it. So I'll tell you about some of those there, but so yeah, chiropractors, acupuncturists are getting trained, OTs, PTs. Yeah.
Athletic trainers.
Yep. And I know PTAs cannot get trained yet, or CODAs. I didn't know athletic trainers could, so that's.
Well, they can do superficial.
Okay.
Yeah.
Okay. They just can't do that. Okay.
Mhm.
So, yeah, so we'll tell the difference when we go through this, you guys. So, we'll just start in, I'm married to Wayne. He's a PT too. Some of you heard that. So anyway, yeah, just a little disclaimer, just saying that, if anything happens, it's not anybody's fault. Just kidding. So this is probably one of the biggest questions I get, and maybe you guys have thought of, is what's the difference between the acupuncture versus the dry needling? A lot of difference. Acupuncture has to do more with energy meridian flows in your body and normalizing those. And it's very superficial. Whereas deep dry needling is targeting trigger points and scar tissue or tendinous tightness, just a different thing, goal you're going for. So the one thing that's the same is you will get a cortisol release. So that's kind of nice. And the other thing that's the same is you are using the same needles. They are acupuncture needles. of various lengths, but they're always about the same diameter, which is very thin. Like they're about this as thin as your hair. Like I can bend them over my finger. I'll show you some. So they're super thin. So yeah, I would say the dry needling, like they're saying, you're restructuring a tissue. So we're actually going in and directly breaking up a knot, or we're breaking up scar tissue. We're restructuring. So that's the difference. It's very direct technique. So this is the other big question that people maybe don't ask, but should know, that is there is a big difference between superficial and deep dry needling. Superficial, you only go in about 1 centimeter. So you're not really even getting down to the muscle tissue sometimes, because sometimes you have to go a little deeper to get to the knot that you're trying to get rid of. Where dry needling, you'll go in sometimes inches, you know, to get down far enough. So it's subcutaneous for superficial, obviously muscular and connective tissue for the deep. Definitely more comfortable doing superficial because you're not going as deep, and less risk of any trauma to any tissues underneath if you wouldn't be where you're supposed to be. But as far as the long-term effects, I think it's really quite different, although research shows that the superficial also gives benefits. So people who do the superficial, you will get benefits as well. I just think sometimes you stay better longer with the deep. Okay, so this is a good question for Chris. So this little deal here has to do with referred pain, you guys. So what they're saying is my jaw suddenly feels better. So he had jaw pain, right? And these are supposed to be mimicking needling to the glutes, okay, of this big mammoth. So, but his jaw pain is going away. So basically it's just saying, know your referred pain patterns, okay? Because that was one thing I got to know so much better when I got certified. And shame on me for not knowing it better, but I don't really remember being taught it. So maybe I missed that day at school. So one thing that is so helpful is for you guys to know referral patterns. So like if you know like temporal headaches come from the upper trap, you'll know I'm going to work on that upper trap, or at least, yes.
Is this it?
Yes. So
when I went to PT school, this
Travel.
is a new one, but that was my Bible.
Yes.
I think, because I had a faculty member who
was really big on this.
Really big on that.
And I wish I would have, because I don't remember. And maybe I'm just, you guys, but I thought I was a good student. Don't we all? But it's so good to know, because if you've got, I never knew that if I had front shoulder pain on a patient, I would always think, is it anterior deltoid? Is it bicep? Is it pecs? But it never dawned on me that it could be infraspinatus way back here. And a lot of times it is. So I would be like missing the boat when I didn't know that front shoulder pain a lot of times can be infraspinatus. So it's just super important to know that. And so I've gotten a lot better with this over the last 7 years, whatever. So anyway, that's big. And that's what this is trying to say, is know your referral pattern so you know what to needle if someone's certain.
You call it your Bible, right?
Yeah, they do call it my Bible. It's my little binder. Yeah, they call it my Bible. So dry needling is a technique used by more than just physical therapists, depending on the state, to treat pain and movement impairments. So you do use a dry needle. There's no medicine in it. Yeah, it's just inserted through the skin into areas of muscle, usually. Sometimes it can be scar tissue or connective tissue. So I don't know if we're going to show the video, just because we're going to show you directly. Okay. Sometimes there'll be a video of me needling somebody, but you guys will get the real deal.
Is that the right one?
Yeah.
Okay.
So targeted tissues, like I said, mine mostly is muscle. But once in a while it will be a tendon or some scar tissue. One of mine that I've done that has made such a big difference is the Achilles tendon. It's such a thick, big tendon. Like I've had people with ruptured Achilles, and that was the thing that got them over the hump of not having pain back there, is you just needled that and broke up some of that connective tissue, scar tissue back there when they repaired it, I suppose. But most of the time it's muscle that I'm targeting. I would guess 90% of the time. Yeah. Oh, did we go way too far?
Did I miss one?
Oh, well, let's see, Chris.
Yep. Oh, wow. I don't know what happened there.
Yeah.
Holy
Chris
buckets.
is sick of me talking.
No.
Talk too much. Just kind of fast forwarded. And some of these.
Is
we
that a
are-
right one, or do I need to go back even more? It's just really slow. That's what's going on.
Yeah, it is really slow. Some of these, when we're talking about okay, we went right
There we
Go to
go.
the contraindications, because I want you guys to notice when we look at those, waiver forms.
There,
Thanks,
okay.
Chris. So if you looked over the questions on some of those forms, some of this is on there, but contraindications would be obviously like cancer at the site. You don't want to be in there, right? Any bloodborne diseases like hepatitis, AIDS, any of that kind of stuff. Skin lesions, if they have open sores, pregnancy. This is an interesting one. So we were taught that not to needle at all during the first trimester because it's such a dangerous time for miscarriages. So we don't want patients to think that we caused a miscarriage by our needling, even though it is not something that will technically cause a miscarriage, but just to be safe, we don't do it in the first trimester. If we know that people are pregnant, we wait until the second or third, and then it's worked really well. I mean, I've done plenty of pregnant women who it works really good. So, risks, you could always get an infection from the little needle, but you really don't even see where it's at most of the time. Pneumothorax, so you could puncture a lung if you don't know what you're doing. You could puncture part of your GI tract if you don't know what you're doing. You can hit a nerve, and I would say I did hit someone's sciatic nerve when I was just starting out, and he knew it and I knew it, and we were done that day. If you hit a sciatic nerve and it's just like they don't want to keep going. So you do have to know where you're at, but some people's nerves and vessels can be in, as you probably learned, can be in different places. So you have a general idea of where they're going to be, but you don't always know. So I listen to my patient. I always tell them, like, if it ever feels different, if it ever feels really shooty and burny, you let me know and I'm out, because that's probably getting close to a nerve, whether I know it's there or not. And then seizures and headaches. I'm guessing if you did some up in the neck, you could get a seizure, I guess, if you went into your spinal cord or somewhere bad, but yeah, that's a risk. I guess you'd have to know not to do that. Side effects, the biggest side effects I see is just delayed muscle soreness, or like actually kind of instant muscle soreness, right? Chris, she laughs, because you're releasing in those knots, you guys, they've biopsied those, and there's like at least five different toxins in those knots that's built up over time. So when we break that up, it's just like all that toxin buildup is just thrown up in that muscle right then. And so it feels really heavy, really achy until your body has a chance to filter it through and get it out of your system.
So you leave the clinic like this, or I drove home like this one day.
Yeah. But I tell people it's about 1 to 2 days. I don't think yours was probably that. Yeah. I just did my son Garrett's lats. He was like super tight from doing landscaping for months, and he felt so sore that night, but the next morning he was like, this is amazing. So some people recover really fast. If you have people, go ahead.
The toxins get removed on their own through like the blood system, or is it the lymphatic system that removes it where movement is required to clear it out?
I think it's both, to be honest. I think it's both, because, and that's why after I needle someone, the things that I instruct them on are drink lots of water to flush it through, and movement, like you're moving through the ranges to pump that out of there. Yep, good question. And then
Scientifically, that makes sense, and I would guess, because you usually, after you dry needle me, then you did range of motion.
yes.
Yeah.
Like I take people through their new range because they're going to have more range, even though they're sore. Generally, I'm going to be able to move them further. I want them to know that. I want their neurological system to know that. So I'll take them to their new end ranges, and we'll just work through it. And then they work through it at home after that. I send them home with just stretching usually. And they can do ice and heat, and they can do ibuprofen or Aleve or whatever their bodies will let them do. I try not to tell anybody what to take for that, because they all have different things their doctors have said they can use. But anyways, once in a while you get a hematoma if I get close to a superficial blood vessel or something, and or if they're on a blood thinner, I'm not holding it down long enough and they're just a bleeder. Sometimes they'll get a little bruise, but other than that, there's really not a lot of things that I've ever had happen. So indications for it: chronic pain, myofascial pain, tons of, really, there's movement disorders. Like if someone's, not moving right, you're like, this is really stiff. you know, we can work through that and break that up. Sometimes, a lot of times you'll have people that I'll end up needling on their opposite side because they have latent, we call them latent trigger points on other areas, or maybe the mirrored side, same muscles that need to be addressed so that they can move properly. So that happens a lot. I'll tell them, I'm gonna do your side that's hurting right now, but in 30% of the cases, you've got stuff on the other side that's affecting this side and causing this pain to happen. So we end up looking at everything, you know, like you're not just going after one muscle and saying, oh, I get him, I think they'll be fixed. Like you just want to make sure you're checking. I know Chris teaches you guys, you know, movement patterns and all that. So we use all that when we're treating. So precautions, blood thinners, you just want to know that so you can apply longer pressure. Cancers, you can needle if it's away from the cancer site. Diabetics, you want to know if they can heal properly, you know, so that you're not causing open sores. Fear of needles, this is huge. Like I've had moms that have coerced their children into letting me do this, and they are so scared, they're literally like crying on the table, and I'm like, no, we're not doing this. So that's huge. If people have a true fear of needles, sometimes they can overcome it if I just show them that it's not a big deal. But if they're truly that bad, you just shouldn't do it. I've tried it a couple of times. You just shouldn't do it.
They probably aren't gonna get any benefit.
No, it's
So
just not mentally going to help them through it.
Yeah.
So I've just gotten, so the youngest I've ever done is a 9-year-old, and he's tough as nails, and his mom paid him $20 and he had a fractured elbow. And he'd said, okay, I'll let you do it for 10 seconds. And I'm like, okay. So I would barely get started. He'd be like, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I'd be like, oh, I'm done, I guess. That was like maybe 3 pokes at the most, you know? So, and the oldest was like, is it 92 or 89? And some of those old people, oh my gosh, they're tougher than nails. They just lay there. Just do whatever you want. So that generation is super tough. So, and then impaired sensation. Yeah, I got some, paraplegic patients, and I really don't try to needle anything below their injury unless they're an incomplete, then I might. But yeah, you just want them to know what they're feeling. I don't usually want to do it. So benefits, decreased pain, increased muscle activation, improved functional movement patterns, all those. So a lot of times I'll measure them when they come in. Like if we do one of you guys' shoulders tonight, I might measure it. We'll get a measurement, and then at the end of the session, we'll measure it again. And there's usually a pretty significant change if you're limited, you know. So techniques, you guys probably don't need to know a lot about this, but we're taught like to kind of do a kind of a fanning or a cone technique, because where you tap in, you have to come almost to the surface every time you redirect that needle. So you can only go so far from that area that you tap in, right? If you pull it out too far, then you can't get back in, break through the, you know, skin layer. So there's ones where you do more of a pecking, that would be more like along your perineals here, I would say, where you're actually hitting bone every time. You're just pecking down to the bone. Sometimes if people are really sensitive, I'll just tap in and I'll have to leave it there because they're just like going nuts already. So I'll leave it in there. I won't even go in and out, and I'll just twist it a little bit just to get a little. I know you guys are like, I got it.
Feel it.
Yeah, it's bringing back, triggering the memories. So it just depends on the person. The electrical stimulation, that's more with the superficial dry needling. I did not get trained in that, but they'll tap in multiple needles, sometimes along a nerve root, and then they'll hook up their E-stem and just leave it on for, I think, like 10 minutes, 15 minutes, just to decrease the tone, I would say, in that along those muscles. But I don't do that, so I don't know much about it, I guess, other than what I said. We're not going to spend a ton of time on this because I'd rather just kind of treat you guys. But basically, when they talk about muscle regeneration, it is that fast sometimes. Like I'll muscle test someone, and if they're got a bad trigger point, they will be weak, they will fatigue quickly, and I can needle that, and by the end of the session, they are strong again because they've got function back. It's a neurological weakness, so it's a quick return usually. You know, it's not like when you're in a cast for 6 weeks and your muscles are nothing. So it's different. And that twitch that they're talking about, the twitch response, if you're in a muscle area that's too tight, that's got too much tone, and you hit that, you'll get this. You'll get that twitch they're talking about. It's like a little mini contraction right there. if the muscle is relaxed and it doesn't have increased tone, you won't get anything. It'll just be going through butter. You know, it's just like smooth. So that's what we want, is that twitch response to know we're in the right spot.
And
And
Lisa
then
gets excited when it happens.
I get very excited.
What is it doing when it does that though? Like,
It's actually going right into that trigger point directly. Physiologically, you're gonna get, like it's saying here, an opioid release, you're gonna be getting, this is the part where I don't get into it super deep, because to be honest, when I had to take my tests in 2017, I had to know some of this stuff. And after that, I'm just like, I'm just treating. I don't need to know chemically what's happening right there, but there is stuff you can read about where it'll show chemically what is happening, you guys. So
Remember the motor end plate and the.
yes. And then the
chemical-
connection with your
Yeah.
brain, I mean, the whole thing. In fact, there might be another slide that comes up, but, it just works. That's what I tell people. It just works, just works. And it's very direct. You're just breaking up stuff. Yeah, so see, now this is where you're.
There
getting
we
more
go.
on the-
Here's the science.
There you go, scientist lady. So you could probably explain this better than me. So yeah, there's just a lot of stuff that's gonna be going on when that needle disrupts that muscle fiber, right? That knot. So my description of the toxins throwing up into the muscle maybe isn't as good as well, but that's what I tell
Bless
people.
you. I know, that makes more sense.
Yeah.
Oh, that's pretty cool.
Cause people aren't gonna, you guys know this, cause you're in these classes probably right now, but yeah, this old dog hasn't been in them for a while, so.
For the toxins held in the synaptic vesicle.
Chris,
Your toxins,
There, when the toxins are released that she was talking about.
so your toxins would be held in the muscle fibers, and then when you get needled, then it releases the toxin from the muscle fiber into the.
It'd
Into
be like
the
the myopathy.
pathway. Right, and that's why I think it's blood and lymph, so that both of those systems are
Yeah.
flushing that out of there.
yeah, what she said, that right there. Yeah, I just.
And I always
you-
say, and I'm not an exercise physiologist, that's what I usually
yeah.
say.
There you go. So some more, how do you like all this, you guys? Some more like nice channel releases, right? So yeah, motor end plate, skeleton. So if that makes sense to you, it makes sense to me. Okay, I know all these things happen, but I try to keep it as simple as possible for this little person and then my patient too. So I just explain it, you know. This is
But we
what's
have
happening.
this, I have this PowerPoint, so.
Yes, so you guys can look over these and pick them apart. And then we're talking about all these loops, right? All the way up to the brain.
Your upper
So-
motor
so
neurons,
that
your
is
lower motor
why-
neurons.
That is why things can change that fast and I love it because of neurology, right?
That's why I tell these guys a lot, ortho's neural, neural's ortho.
Oh, it is so, it is like
Everything's
this, you
neural,
guys. When,
yeah.
if people try to separate the two, they are not, they're missing the boat. They're missing the boat a little bit.
Cause always in school is like, oh, I don't like neural, it's too hard, I'm just gonna do ortho. No, you're not.
No,
Yeah,
yeah,
it's
I
all
agree with
about
Chris
this,
100%. Like, they aren't separated. So when people ask me like, well, who all should you needle if you, I'm like, anybody, everybody,
Anybody?
if they need it. So these just have to do with, studies that show that it works, that there's an increase, of time of return to work, increased activation of the multifidi. This was a back study, and then decreased pain. So it kind of just is going through and it's saying there's little motor plate stuff there. They actually check this biochemical and electrical dysfunction at the motor end plates. So there you go. And yeah, it just shows it goes back to normal. So we'll kind of. So these are the different ones that they had on this slide PowerPoint when they first started giving it, and there's more now. So these are there's probably a lot more. Myopene is the one I did, that third one down. I know some people in Big Stone have done kinetic core too, and I don't know about the other ones. If we have people in our company that have done the other ones or not, but
Are your certificates nationally or is it based out of states?
that's a good question.
That's a good question.
But I think it depends probably on your state law. Like for a while, South Dakota PTs couldn't do dry needling up till maybe a couple years ago. Could not dry needle. And then that law passed and then they could. So I haven't actually looked that up, I suppose, because I just work in Minnesota. But, I would think if you're certified through a certain company, you're certified through that company. So if dry needling is allowed in that state by a PT, I would guess you are certified. That's just my own take on it, though.
I would agree with you, right? It's your
Because-
what is your practice act? And
Right.
usually a PT's practice act is pretty, I didn't know that, usually, because there's usually bigger differences for physical therapist assistants
Yes.
from state to state.
Yes,
but
I would agree with
PTs, I didn't
Chris.
know that, yeah.
Yeah, I would agree with Chris. So.
Yeah.
Yeah, but now South Dakota has it too, so we're no problem there, because we have some clinics in South Dakota, obviously, too, but billing, you guys don't really probably need to know this. It is not covered by Medicare right now, though, which is kind of, not so fun. But I tell you what, Medicare patients pay out of pocket for it because they know it works. So even these little old people.
What
and-
what are those codes?
Those are the codes that Medicare set up, those are our CPT codes.
Right, but you have to, you
We
have-
have to use those.
right, but like when I came, I paid for the needles, is that?
No, you paid, it's a one, so when we do it,
Yeah.
it's a non-timed
Non-time
charge.
code, yeah.
So it wouldn't matter if I did it for 4 minutes or 40 minutes, it's one charge. And, yeah, the two codes here is, say you do just 1 or 2 muscles, you do that top code. But if I do more than 2 muscles, then I'm gonna use that lower code.
Got it, yep.
And I'm usually always using that lower code, because I wanna get people, like, I wanna figure out a pattern of tightness and get rid of it.
She'll
So-
need it to you till you.
Yeah,
wave the white
Right,
flag.
that's Chris knows.
Can I do one more? I don't know.
I don't know, am I thoroughly dead yet? So, I have learned a little bit that you have to take it easy on the first session, because it is a little bit of a, when people come in and their inflammation's way up here, you guys, and they are at that threshold where they get pain really easily. You can't go in and just start, needling them to death, or they will just explode with pain. So I have learned you have to kind of peel away the layers slowly. Maybe you just do 2 or 3 muscles that first day, see how their body reacts, and then the next time they're gonna tolerate it better, so then you could do more. But that's a good thing to remember. And I also remembered that it makes a difference which muscles you start with. Even though I know it's the adductor or the groin that's the problem, I will not start there, because it's so sensitive in that perineal area that they will never let you do anything again if you start there. So there's certain things I won't do. I don't usually start on a calf muscle either. Don't usually start on an upper trap. There's just some that are more intense than other ones. So I usually start a little bit away from it and work toward it, but I like to educate my patients a lot so that they are calm and they know what I'm gonna do, and they know I'm confident that it's gonna help them. Chronic pain, I see a lot of chronic pain people who just, they haven't got relief. They're wanting something to help, and so they're very willing to try it. So, it's just a tool. It's a tool I use a lot. But it's just a tool. You can get good results from other things we do as well. I felt like I wanted to learn this because I would get patients about 80 to 90% better, but then I couldn't get them 100% better. And with this, I feel like I can get them all the way there. And so, most of the time. So, yeah, I make sure I explain the difference between acupuncture, because if they've had that before, they might be confused about what we're doing. Fear, like I said, when they say show them on yourself, I had a lady, she wouldn't let me do her perineals, and she had ankle surgery, and I'm like, if you just let me do that, I know we'll get rid of your pain. And one day I said, you want to see? And I just pulled up and I showed her, and she goes, that's it. And I go, yep. So she let me do it, and so sometimes they just have to see it. Yeah, so when it says if all else fails, have them watch, right? A lot of times that fear goes away if they just realize it's not as big as they think it is in their head. So this is almost the end, you guys. So, do you guys have any questions about? I know it's a lot.
Do you actually let them try it on you?
No,
Oh.
they don't try it on me.
I was like, that's kind of cool.
Visual audio aid for patients. So let them try it. No, I don't know, put that out there. I would not let them try it on me.
I was like, dang.
I wouldn't even let my husband try it on me, and he's a PT. So, yeah, he told me once, I'll do it. I go, no, I choose life. Cause you could really hit some bad things, you guys. You could hit a lung, you could hit a vessel if you're messing with someone's SCM, and aren't going the right direction. Like, that's why you get trained, right? So you do want to, and if I'm not comfortable doing an area, even though I've been trained in it, I just don't do it. I don't want to do it. So I just don't. So I'm just gonna do what I'm comfortable doing. Where I feel like I won't hurt the patient, because that's the number one thing, won't hurt your patient. So you're safe, I'm not gonna hurt you. At least I'm not.
It's gonna hurt, but.
I'm not trying to anyway. But if you guys want to see what it looks like. Is there something that you want me to needle on you that might be tight already?
Probably my shoulder.
Love it. Love doing shoulders, especially on guys, because then you can just, that would be great. So do you feel limited in your range of motion, or do you feel painful or weak or what?
Usually pain, and probably the supraspinatus when lifting, and then just kind of like all the time achy.
Is it
But-
right where you're rubbing?
Yeah, like right through here. I've had Chris work on it more than a few times.
Are you right or left handed?
Right-handed.
Okay, I'm gonna have you stand up for a second. I wish I would have brought my gonies. didn't.
I have one.
Do you?
Oh, I have all kinds of them.
Like,
There's one right here. I thought she might want.
Okay, thank you. So let's just have you reach up into flexion, as far as you think you can go. If you're 80,
Next hour.
are you?
Yeah.
Okay, well, that might explain it. Yeah, you're at 157. Right? So let's see what this, yep, I sure do. So this is your so-called good arm.
He's like, how do I fix that? I'm like, quit powerlifting.
Yeah.
Did quit.
Good instruction. So this one's a little better, it's like 161, but they're both limited, right? So. What I think of right away is lats. Because lats will refer right there too, and they are used a lot in lifting heavy weights, okay? So even though you're already telling me it's the supraspinatus, it's this. I'm gonna just, I'm taking in all you're telling me, right?
Mhm.
Problem solving, so I'm gonna do just a quick muscle test on you. So we got our measurement, 157 and 161. I measured this one, sometimes when I do this one hurts, right? So we got 157, you girls are smart, no one remember that. So arms out here. Okay, don't let me push. Okay, over the side. Don't let me push. Good, reach back. Don't let me push this one. Good, don't let me push this one. Good, and then right here. Okay, you're gonna roll them out. Don't let me swing them in, okay? Keep them out, keep them out, keep them out. Not bad. More like that, yep, don't let me pull. You're actually pretty darn strong, you don't have weakness in that external rotation, which I do see in a lot of people, but yours is pretty good. So, can you slip off at least your outer one? I'll see what your other one looks like, but I might have to have you take that other one off.
I'll just take my foot.
Are you good?
Are you, and he's your subject?
He's gonna be my subject.
Oh, are you gonna have him sit? You can use any one of these tables?
I'm gonna be using the table.
Yeah.
Yep, for sure, 'cause I don't want him to pass out. So I lay everybody down, we are taught that, lay everybody down because you don't know how their sympathetic system is gonna react. So you do not want people falling over. Did we have you already fill in these out?
Yeah.
Yeah.
Perfect. So I have to just work with these. So this, I know you signed that, but you do have yes to any of those questions. Just look through 'em- just look through them real quick. I know you're not pregnant.
I was
but-
like, we talked about that class today, but you weren't in my.
I broke
class,
the
so.
pen.
What?
I broke the pen. It's like stuck.
So are we good there? You wanna circle them quick?
Oh, no,
Oh, do you want a pen?
I said to eat one, but
That's okay, and that one's fine. Okay. Basically, you know, you do it anyway, I don't wanna be acting like I know what's wrong with you or not.
The middle.
Okay, so we're gonna use this one, I think. So the children will get really nice physical twitches, which is kind of fun, girl, so
Oh, this is gonna be fun.
even though Slade can't see you. That right one, so. I'm gonna feel through some stuff first. So we've already done your range and your,
you want me to
muscle
sit like
testing.
this side, so my right's on outside.
You know what we're gonna end up doing? Because I generally start with you on your stomach when I do a shoulder, I do the back first. Because the front is more sensitive. So again, I've kind of learned, don't start in the front. So I want to feel through this quick though, and you tell me if any of these muscles are sensitive. A little bit cordy. Very much.
Cordy.
Cordy.
Yep.
Cordy. Grizzly, Cordy, right there hurts more, okay. All right. We are about at Terry's Minor, yep, pretty darn close, or it might be, a little bit of infraspaz, you know, they go all along there.
Like, she could call that school and just get you in. He's
Yeah.
on the wait list at a few schools. You could
Is
just
he?
call him.
Oh.
What are you, Mary?
No, I went to USD.
You're
St. Scholastica waitlist me today.
Who
For
did?
your husband.
Yes, it is.
St. Scholastica, so you're on 4 wait lists now.
Yeah.
Right?
I think 4, yeah.
What are you going for?
PT.
Right there,
That's what it was for.
that's your lab. So how long did you power lift for?
For about 5 years.
Okay. Oh, I'll go back there. Okay. Little smaller amount?
Yeah.
Deep breath. Not too bad up there. Okay, so we've felt through your rotator cuff, because that's where I start every time, because that helps with positioning of your shoulder, right? Where did you say your pain goes to? Right there, pretty specific.
Yeah.
So normally, I would tell you that is either probably, if it's that specific, gonna be your pec major, or it's gonna be your lat. So let's put you on your tummy, and you're gonna have your face down there, so I'm gonna take out that middle little hole thing. And then just this.
Go up and down. Oh, this.
Okay, there, it's pretty flat, I just didn't want to do it too much. There you go, that better, yeah. All right. Yep, thank you, assistant, for making that so nice, no.
I teach them all to make their patients comfortable.
That's right. That's right. Okay, so I'm gonna actually put, this here, just hanging it over, so I can get to those lats. Lats usually have the most points right out here. They're gonna be a little thicker, so I'm gonna stick with these longer ones.
Tell me if you need anything.
I'm just gonna use this other mat as my little,
We have a little table.
do you? Oh, aren't you guys nice? So if you guys wanna look at these, this is what the needles look like. They're very thin. Do you wanna see one, Slade?
I've seen them.
Have you?
Yeah.
So the darker part here is the handle. It's about that long. And then the actual needle is from there to there. Okay, so these are my two favorite sizes. Sometimes to get through this thick of muscle, I end up taking this size with a guy his size. You two would probably use this one. But you see how that pinked up already that quick? That is a good sign that that's where we need to go. That is, you ever heard of skin rolling? You guys heard of that yet? You just roll over the area and you look where it pinks up. You know, ding, ding, we have a winner. So anyway, we're gonna go right here. Okay, then. So you're gonna tap in like that. That's just a tube. There was a little switch. There was another one.
Ooh,
You guys seeing something?
yeah. You really internally rotated on that second one you did.
You can visibly see it a lot of times.
Wait, how do you feel?
Go through that.
Yeah, you can't even really see the needle.
No, I can't.
I'm trying to fan it. See, I tried to get a little too greedy, so I wanted to move it over more, but you can only fan so far, because I'm searching for to get the whole band covered, you know, you want to get the whole thing, so I'm kind of like, okay, we'll move over here. Did it go anywhere, or did it stay there? You know what I'm asking, Slade?
Yeah.
So sometimes it'll refer to the front of the shoulder, down the side, down the arm, so if anything moves, you let me know. Oh, boy. So I keep trying to. Big deal, I love it. So when I'm hitting those girls and you're seeing those switches, that means those are hypertonic muscles. They are not meant to be that tight. This is a little long on my pinch. I do. It's up. But it's funny because that patient keeps coming back. She just likes to be funny. So I'm like, okay. Wayne said, you have to put it up, so I do. And I don't mind it, it makes me laugh. They made me cry the first time I saw it. It's so funny. Okay, so those are staying right there still?
Yep.
Okay, we're gonna go out to the edge just a smidge here.
It's like.
Work one,
Yeah.
I have needled like someone's TFL and the opposite one.
Really?
Plenty of times. Yep, and other muscles too, they'll be like, that one on that side, they go, did you see that? I'm like, yep. So it is kind of funky what your body will tell itself. That
So
one's
your
stay there.
certification, how many hundreds of hours was it?
Well, it actually, mine, they didn't make me log the hours,
Mhm.
but they, they'd have us practice for 3 months after, 3 to 6 months after each class, like it probably took a little over a year. I had 3 classes, we learned about 33 muscles each time. Yeah, that's a lot.
You can feel it.
You can feel it
There,
yourself.
that's what I wanted to see, a little of that. So nowadays, they're doing it different with some of these classes, though. Like, they're actually making you log hours, and they didn't for me, Chris. But I have a gal over in Granite Falls, you see how bad that one was, guys?
Allie?
Whole arm,
Talking about Allie.
yes. She's having to log hours.
She just got her second one done, didn't she?
I don't know.
Oh, no.
Why?
Why?
If you can like
She's doing like.
go through the
weeks, right?
certification path.
She had her baby early,
Oh, did she?
yes, she just.
You
had
mean,
her-
why can't anybody dry needle?
Like, why can't anybody go to the certification and get certified for it?
You mean,
Oh,
if you're not a
PTs and
PT or an
PTAs?
OT or, you gotta have a really
Have
good
to have a-
understanding of your anatomy, like
So nobody's-
Extensive.
extensive
Cause
understanding.
like
of your anatomy.
PT and, or PTAs, I don't think have to take, cadaver anatomy most of the time at most schools. Is that right, Chris?
Mhm, depends on the school, but no, right.
But it's not a requirement for
Mhm.
PTAs. I don't think they have to have a cadaver lab and all that good stuff.
Like I remember when Lisa was doing mine right here, she got up, she's like, I just don't wanna hit your femoral artery, and I appreciate that, thank you very much.
We found them both. She was good,
Yeah,
but that's
Okay.
why when Wayne's like, I'll needle you, I'm like, no, you
no,
won't.
you don't, no, you won't,
I
yeah.
like my body.
Well, it's hard, cause some of these guys, like they buy the little cupping thing, they buy them on Amazon, I know, she got it for her birthday. But all these students are using cupping and they call it scraping,
Scraping,
instrument
exactly.
assisted, and so, yeah. This is a whole different
Buy some
ballgame.
needles.
Yeah.
Oh, God.
Actually, they won't let you now. The
Really?
rules on ordering these is getting a lot stricter.
Well, that's probably
Because
good.
I think that's what was happening.
Probably, mhm.
I think
That's
people were
crazy.
I'm
just,
sure there was TikTok videos, and
Yeah,
like I can do that.
yeah, I think that is what was happening, because for a while there, like, they weren't sending up to us, and I was like, Shalina, what is up? And she called, and they're like, they're just really strict
Mhm.
because of, yeah.
Cause somebody would open a clinic in Sweetwood, that'd be good.
Oh, 100%.
Yeah.
There's.
So the reason I'm still after this bad boy is because if you don't get it released a little bit better, it will just get mad, and then it will tighten up, and then you'll be really sore. So I don't kind of like Slade, so I don't want him to be, it's kind of like waking up a beast. So he's got some knots in there, and if I just kind of poke the beast,
Mm.
it's gonna be really bad because it just woke up. But if I kill the beast, that's different, right? Then the beast is dead and it'll just lay there dead, sore, right? But, so I'm kind of trying to get it dead enough where it will be hopefully better for you. Yeah, dead enough. Try to get enough of it out of there. Or it won't be giving us those super big twitches at least, but it is getting softer, I can tell. So normally I would just start off looking at your rotator cuffs. So I'm doing a little lat today because I think that's what your problem is, but normally I do infraspinatus, supra, teres minor. And if they're up for it, I would do the subscap, but a lot of people don't like that armpit area. It is a toughie. So sometimes I don't do that the first time because they would run away.
Slade does, I think I've done some manual therapy on his.
Yeah, you've done this.
Before, yeah.
So really with a little bit of infra there, one more time.
See, there was a lot of resistance on that one spot,
It's a
yeah.
lot of resistance and that sometimes, like Chris is saying, like. It will. Start to twitch a little bit finally. So I'll have people, if I know that spot, they won't twitch at all. But I'll know it's something's wrong with it, like I've had TFLs that are so tight, they won't even twitch. So the first time I'll treat them, I'm just breaking up the rock, and then the next time they come in, I'll go after it again, and it's like the biggest twitches, they're just like. Yeah,
That's crazy.
had a shoulder guy, I needled him 3 times at least before I got any twitches. He hadn't lifted his arm above here for 8 years, he had a rotator cuff tear, and then he got it fixed, and we got it back to almost full range. Cause he sucked it up and let me do this all the time, dying, but anyway, so.
Do you know how this developed? Did people just decide to take acupuncture needles and?
I'm trying to remember what they said,
Mhm.
have to
look
if
up-
it
look
was
up.
a little bit of, if it was a little bit of Janet Travell-ish, background, obviously, right, with the trigger
Mhm,
points
mhm.
and then this, what was his name? There was a doctor that was more the head of it. I can't think of his name right now. But yeah, he is the one that kind of combined her
yep.
trigger points with this.
Mhm, mhm.
And yeah, that's how it was born.
Yeah.
I'm trying to think, he was not from the United States, I don't think so.
Probably like the guy who developed the strain counter strain, you know.
Yeah,
all those things,
exactly.
just Trying stuff.
Right, just
Yeah.
messing around, trying to see if that was just a fluke, I think, the strain
Mhm.
counter strain, it's like he leaves him in the room in a comfortable position for what, 20 minutes, comes back, it's fixed. Okay, so I'm gonna look at one more here, even though most of the time, just to be honest, Slade, I end up having to see somebody, if you've got this much limitation and this much tightness, I end up seeing them probably. I might needle this shoulder 2 or 3 times because I'll only do so much at one session. Cause it hurts, you know? And then if I end up having to do some stuff across here, which happens a lot, like levator, middle trap, upper trap. Or if I end up doing some of your deltoid, which is big on lifting, right? Like, but you didn't have a lot of tenderness up here, but you are a little cordy, so I'm just gonna check it out.
Cordy, that's Lisa's word.
There we go.
Sound like a ropey bump.
Cordy, like you just feel, she probably is feeling
You
like,
guys seeing this guy?
Yeah.
You guys seeing this?
fun.
This is.
Like the way I describe it to patients sometimes, like I'm playing your guitar string.
Yeah,
It's a chord.
I always say I could play a tune on this.
Ooh, that's a good
You guys see this guy? He is mad. Even though he's not telling you he's mad, he's mad. You might not, when you talk about pain going down if you ever get it down the side of your arm or down the front, referring more, it's probably this guy.
I really like that poke in the bear analogy.
Yeah,
Yeah.
Well,
Makes sense. Yeah.
I mean, I'm still going in here because he's still twitching. Once he kind of quits, I'll give up too, but.
Slade, how's it feel?
Not too bad.
You're so good, Slade. It's not bad.
Do you see the puddle of tears on the floor right there?
I know.
Face.
Well, and sometimes I'm going pretty deep and the needle starts to dull. And so you can't keep going because it actually will be harder to go through the tissue. Especially if you hit bone, then it definitely will.
Did you hit his bones?
Not yet, but I was hoping to. You kind of want to get all the way through them. Sometimes the trigger points are way at the bottom, but his is loosening up. So I usually look through it one more time, even if I get a lot of good twitches, because I want to make sure it's twitched out. I'm gonna do one more right here, and we'll leave the supraspinatus alone. And And we'll just let you stand and. You can even move your arm. There's a little bit right.
That'll be fun. Right.
I can't. There, now we're getting. Sometimes you can't get through it, it's so tight. So you have to kind of be patient and wait for it to loose. He's doing great, actually. Slade, I have to give you credit because, my husband would be screaming. I did his quad once and he was just. But then he calmed down. And he let me do it. And then he could run again. He was funny though.
I had Allie. do
Cause it
the
does.
First time, so I think that helped.
Oh, so
Yes.
you, this is not, okay.
Well, that's good.
But she does like the pistoning with the electrodes too.
Oh, does she?
Keeps them, yeah.
Okay. Okay, that's better right there. Can you tell that?
Yeah.
So sometimes the patients will say, oh, that's way better, like they can feel it soften up too. Okay, so we did supra, we did a little bit of infra, we did a little bit of lat. And I might have caught a teeny bit of teres minor, but still feels pretty tight right there. But let's just see what you got, because we could be here all night. And your poor shoulder's probably gonna be saying, ow. So you can, technically, you could take something if you wish.
Oh, Michelle's like that, because I'm like, if you went to a doctor and they gave you ibuprofen, this is how much they give you, but I'm not telling you.
Yeah, that's why I'm like,
Doctors say.
I always say, take whatever you normally take from muscle pain. That's what I'll say. Okay, let's let you sit up once. Actually, flip over. I'm gonna stretch his shoulder through the range. Usually that's what I would do. Before I would let them go, because they don't want to move it much at first.
Does your arm feel really heavy?
Whoa, heavy. Not too bad.
And if I hear some crunching or cracking, I usually love that. Because it means it's adjusting. We're basically being a chiropractor right now. Because the muscles that are pulling them out of place, if they're neurologically going back into their tone, they will let you go into the right spot. Especially if it's a rotator cuff stuff we're doing, because those are your stabilizers, right? For the positioning of your shoulder.
What's it cost on something? At your place?
50 each time we do it. It was 40. They raised it to 50 in the last, I don't know, in September maybe, or October. So how much pinch do you get to the top, Slade? Up here. Do you get much pinch? Good. So if people are pinching at the top, that usually tells me that there's still something tight limiting them. Maybe Chris had loosened up your subscap enough at the beginning. You don't need it.
Oh, man, I haven't dug in his arm
Yeah,
for quite a while.
Like a month and a half. probably.
Really? I mean, there's some stuff in there, some lat still a little bit, but not bad. Okay, let's let you stand up once. Okay, we gotta get a little measure. Okay, come over. We're gonna do the right one first, so go ahead and get your try as you can. Better for sure. Not cheap, I want it to be better. Okay, this is 160. I'm gonna say 7, because I don't wanna lie.
And it was 106.
158 or 157 and then 161.
Yep, so you gained about 10 degrees. Probably close to 10.
Mhm.
Let's see what the other one's
That's
got.
pretty good for
The left.
15 minutes.
And it may not have gained any, but you will be surprised, depending on what's tight on people. This one's shaking, you guys. This one did not change. It's right in that 160 range still, or just over like 161. So sometimes they change, sometimes they don't, but so see, I got someone though that's got some middle trap stuff going on or upper trap, and I treat the opposite side. It's amazing because they talk to each other again. And all of a sudden this one will just go. I'll be like, dang, this one just gained 10 degrees and I didn't touch it. So it's crazy.
Cool.
Crazy. But anyways, hopefully that side doesn't feel too sore tomorrow, but just keep moving it, Slade. Drink water. Take some drugs if you wish. Eat or ice, all that good stuff. So, yeah, I don't know. It's probably getting a little late for you girls. So unless